Hello, everyone. Thank you for coming to my in-service today. Today, we're going to be talking about the standardized assessment known as the School Function Assessment, also shortened to SFA. My name is Sloan Cromwell. I'm an occupational therapy student at Presbyterian College's Occupational Therapy Doctoral Program. And this specific in-service is going to look more into the method of administering this assessment in a telehealth method. So like I said, I'm going to be teaching you all today how to administer the SFA via telehealth. So with the up and coming technology and with the pandemic that's been going on, a lot of appointments and therapy sessions have been moved to virtual, and that's been kind of very difficult for therapists who maybe don't have access to technology or don't have the basic knowledge to administer therapy sessions and specifically standardized assessments via telehealth. So today we're going to learn a little more about the school function assessment and how to do so over a screen. So first thing we're going to start out with a little icebreaker. If you don't feel like turning on your mic, that's fine. You can send it in the chat. But I want you all to tell me at least one thing that you think of when you first hear the words school function assessment. Yes, Caroline.
Handwriting.
Handwriting, good. Anyone else have anything?
Math.
Math, good.
Math. Arithmetics.
Arithmetic's good. Okay, so I'm glad you guys already have some thoughts going. We're going to move on. So now we've heard the word school function assessment. Let's learn a little more about it. And without learning, or you can't have learning without a little assessment within that. So we're going to quiz you guys a little bit before we get started. So looking at this multiple choice question, I want you to put your answer in the chat. Which of the following is not one of the parts that compromising the areas being examined in the SFA? So there are main parts in the school function assessment. Which one of those is not one of them? A, participation. B, habits, routines, rituals. C, task supports. D, activity performance. Please put your answer in the chat. All right, does everyone have an answer? Okay, move on to the next question. Question number 2, the purpose of this school function assessment is to assist evaluation of an elementary school student's participation in various school-related activities, his or her support needs, and his or her performance of specific school-related functional activities. True or false? Put it in the chat, please. Okay, last one of this pretest. The SFA can be administered to which of the following people? A, student. B, peer. C, teacher. D, guidance counselor. Or E, both C and D. All right. So we'll come back to the answers of those pretest questions here in a minute. Thank you for participating. So before we get learn more about the assessment, I'm going to have some objectives here that I want you all to be proficient in at the end of this training. So the first objective, I want you all as therapists to be able to administer the school function assessment in a standardized manner, whether that's via telehealth or in person. But specifically for this training, we're going to focus on telehealth. Second objective, I want you all to be able to score the assessment results correctly by using the administration manual. Next objective is to interpret scores in relation to criterion cutoff scores for evaluation of eligibility for special education services. I know that's a lot right now, but you'll learn more about it later in this Zoom. Fourth objective, I want you all to be able to explain score interpretation to school professionals and parents within your IEP meetings, as you are both practicing or future occupational therapists in the school-based setting, and why you're here learning how to complete this via telehealth. And lastly, the objective, I want you to be able to describe the role of occupational therapy in utilizing the school function assessment in practice, and again, specifically in via telehealth. All right. So based on your knowledge as practitioners, why were those your first thoughts? Like you said at the beginning, I heard arithmetics and handwriting. When you first heard school function assessment, why were those the first things that came to your mind? You can put it in the chat or you can say it out loud.
I was thinking handwriting because I think in order to function in a classroom, you have to have those functional abilities needed to complete work, which would be handwriting.
That's a great thought, because handwriting is a major component of school and functioning. So it's a great first thought. I'm having trouble looking at the chat, but we can check on it later. So that's a good way of starting our discussion and getting our thoughts going about the school function assessment. So let's go dive deeper into what it actually is. So our answers to our questions earlier. The first one, which of the following is not one of the parts being examined? That was habits, routines, and rituals. So there are three main parts of the school function assessment, which are participation, task supports, and activity performance. Those are the three main sections of the assessment that whoever is administering and responding to are going to be assessing the student. So the next statement is true. So again, they are looking at those three main sections of the assessment, and all of those are specific to school-related functional activities. Lastly, the school function assessment can be administered to any school professional, whether that be a teacher, special ed, or general education, special teacher, guidance counselor, or principal. It's really anyone who has observed the student and their level of function and participation. So you obviously could not administer this assessment directly to the student or someone in their class. It would have to be a professional. So again, what is the school function assessment? Specifically, I've mentioned a few little details here and there, but I'm going to actually give you a quick little excerpt from the manual because it really helped me understand what it was when I was first learning about it. So it's used to measure a student's performance of functional tasks that support his or her participation in the academic and social aspects of an elementary school program. So it's specifically for assessing students between the grades of kindergarten through sixth grade. So that is 6 years old all the way up to 12 years old. And you can find these details later on. I did send you guys, along with the link to the Zoom, I send you a handout with main details and vital information about the assessment in case you wanted to take that with you and just have it at hand whenever you're choosing which assessment to administer at the time. So, and specifically for those children age or grades K through 6. It's designed to facilitate collaborative program planning for students with a variety of disabling conditions. So it's a questionnaire assessment for the school professional, and it's really used to gauge the limitations of the student and see if they're eligible for special education services. With that being said, and with your handout, do you guys have any questions before we move forward? Okay. So this is the first main part of one of the three of the sections being assessed in the school function assessment. So part one is called participation. And what it does is it examines the student's level of participation, but in 6 major school activities or activity settings. And that is regular or special education classroom, in the playground or at recess, transportation to or from school and a school setting. So that could be to school, from the after school program, and so on. In the bathroom, transitions to and from the classroom, and mealtime or snack time. So you're assessing and analyzing their participation in those 6 major settings. The way they grade each of those activity settings is on a scale of 1 to 6. And what you would do is you would select a number based off their level of participation. And that ranges from participation is extremely limited all the way to full participation. And they have those labeled clearly on the record form, which I have here. And the grading scale is within the booklet. And we'll talk more about scoring and the record form later on, but that's just what it looks like in person. So the second out of the 3 parts being assessed is task supports. So when you hear that, you may not fully understand what it is at first. It definitely confused me for a second, but what it does is it examines the extent to which the student's current performance of school-related tasks depends on additional supports beyond those typically provided to all students. So it's pretty much things that they may need to help them be successful in the school. And those are examined in 2 main categories, whether that's physical task or cognitive slash behavioral task. And in both of those categories, you are grading their level of assistance and their level of adaptations. So the grading for the assistance ranges on a scale from 1 to 4, from extensive assistance to no assistance at all. And same thing goes for adaptation, from extensive adaptations to no adaptation. So do they need that supportive chair, or do they not need any help or any extra supports, physical or cognitive behavioral supports? Lastly, the third part being examined is activity performance. So this is different than like participation. It's how they're actually performing in their activities, whether that is physical activity or cognitive behavioral activity performance. So those are the 2 main categories, again, that they're going to be assessing in this part of the assessment. And the grading scale ranges from 1 to 4, whether 1 being they do not perform the activity, or all the way up to a 4 where there's consistent performance. So there are difference between partial performance and inconsistent. And if you're unaware, so say you're the occupational therapist answering questions in this assessment, and you can't tell if the student is inconsistently performing or just partially performing. There's actually examples, which we'll talk about later on in this presentation, but there's an example guide that has different examples of what that different type of performance may look like if you can't think of it off the top of your head. Do you guys have any questions? Okay. So looking at the left of your screen, that is the main cover of the user manual. So when you get the whole kit, so the whole kit of testing materials, if you wanted to purchase it through your school district or from your school, it is about $268, but that comes with numerous copies of the testing materials. This user manual will have all the main information that I'm telling you now. In case you do forget, you can refer back to it, and it's got all your scores in the back that you will refer to when when you're plotting your scores and finding your criterion standard form scores. So that's the manual. In the middle is your record form. So I showed that to you guys earlier. The record form is pretty much going to be individualized to the student that's being assessed. So it's going to have their information, sorry, and your information. So the one who's filling it out. Then a little bit more information. It gets pretty detailed as to like how they're able to speak, what types of disabilities or impairments they may have, where they go to school, what kind of school. It's very detailed, just so you're getting all of the necessary information you need. And within that record form, on your right side of your screen, you'll see a scoring example. So that is one section of your task support scoring. So specifically, it's got cognitive behavioral there. And one of them, it says memory and understanding. So it says the student is able to understand and remember directions, locations, routines, and use of classroom materials following a series of 3 or more related instructions. So that's very specific. It's very specific for a reason, so you understand. It has a number in there, so then you can really relate back to the key. If you can't remember what the 1 through 4 is, you'll look at the bottom of the page, and it has keys for assistance and adaptations. So then you see at the bottom it says minimal assistance. Well, what does minimal assistance mean? That's when you would refer to the rating scale guide, which has, so if we flip to part 2, task support, it has, you can flip to the minimal assistance part, and it has specific examples of that skill to help you think. Like, for example, student may need extra help copying with negative events, like they're not chosen first in the classroom, but for the most of the time responds to typical classroom procedures or routines. That's when you as a therapist, or if you're helping someone complete this assessment, use your clinical reasoning skills to determine which number and which rating you're going to give the student for that skill. So those are just a few of this testing materials, and we'll learn a little bit about more of them in the next couple slides and how to score it. So like I said before, I talked about the rating scale guide. It's pretty much your go-to, and it's something you need to have open while you're filling it out. Especially us as therapists will become more and more familiar with it as we administer it more frequently than, say, you are, as a therapist, you're giving this to the student's teacher to complete themselves. They may not know, did my student, did they require maximal assistance, or did they require minimal adaptations? I don't really know, but they can use this scale guide to have definitions and examples of each skill while they're rating the student. So if you look again in the middle, we have between a 1 and a 2 of activity performance. So a 2 says partial performance, and they have sample items of moves on uneven surfaces, so a physical activity performance. And then the other one is asking permission in context where it is required. So that's a cognitive behavioral activity performance. And then a 1 would be does not perform at all. So again, there are examples on there. I apologize for the lighting on there. It is a little difficult to read, but it says they're able to makes a meaningful contribution or attempt in the activity, but is unable to complete the full activity or can do so only with significant cueing or direction. And then does not perform is pretty self-explanatory. They're not performing the activity because it is too difficult for them, and they can't assess their performance due to their skills that they do not possess. So here is an example. And what I'm going to have you guys do after hearing this example, I want you to try to give this student a rating just based on their activity performance level. Okay, so that would be a 1 through a 4. So a 10-year-old child in a physical education class attempts to begin warm-up exercises, but quickly fatigues and sits down just a few minutes into the class period. After the teacher reminds the student to continue to participate and assist them in standing up, the student begins to participate again. Later in class, the same student leaves their current activity to run to the water fountain in the hallway. The teacher quickly stops the student that they need to act and reminds them that they need to ask before running out of the room, as it is against the school rules and can be unsafe. So now looking back on this activity performance rating scale guide, I want you all to tell me out loud, would you give them a 1, 2, 3, or 4 for their level of performance? And if you need me to go back to the example, I will.
I'm gonna give a 3, inconsistent.
Okay. Ms. Cromwell, do you have an idea of what rating you would give this 10-year-old? 1, 2, 3, or 4?
I'm having a little bit of difficulty in reading the metrics. Sorry.
I'll give you guys a hint. I have a zoomed in version right here. Would it be a 1 or a 2?
A 2.
2.
Yes. So the student, they tried the warm-up exercises and then quickly fatigued and wasn't able to complete the full activity. So if you read here, they weren't able to complete the full activity. And then when the teacher came and helped them get up, so that's significant cueing or direction, they were able to continue to participate. So that would be their physical activity performance. And then cognitive, the student ran out of the room to get the go to the water fountain, but when the teacher had to immediately stop them and remind them that it was unsafe and against the rules, the student stopped. So yes, that would be a 2. Good job. So lastly, on the scoring materials, we have the summary score form. So once you add up all of the scores that you have rated the student with inside of the record form, you are going to document those on the back here in the category. So here we have our total raw score, which we'll talk about on the next slide, which is going to be the sum of all of the ratings that you have all together. And those will be categorized in participation, and task supports and activity performance, same thing. But when you go to criterion score and standard error score, that's when you're going to have to resort to the manual. You'll actually flip to the back to Appendix B. Appendix B is where you'll have all of the criterion and standard error scores. So it'll look something like this. It's got some columns. And what you'll do is you'll find whatever raw score you have gotten and then go over to the respective criterion or standard error score. And we'll talk more about what those mean, but this is just the form that's on the back of the record form to document the necessary scores that you need to submit for insurance billing. So like I mentioned, you've got your raw score that is a sum of all of the ratings given in each part. I don't know if you noticed at the bottom of the record form sheets, you have this little section down here where you'll write the total of the ratings, and then you have to initial. Whoever is completing this part of this assessment has to initial here, otherwise it's invalid. And then your criterion score. You may not understand what criterion score means. It's different from a normative score or norm reference score. So normative scores in other assessments, other standardized assessments, you may see that when you're finding your raw score in the back of the book, and then you'll say a normative score, that's where the student should be functionally in comparison to their peers or a typically developing child their age. So criterion scores are different. It's a scaled score ranging from 0 to 100, and it's their current position on a continuum of function that's represented by the item of that scale. So they're not being compared to another peer their age that is typically developing. So then if you were to assess this same student with this school function assessment later on in your therapy sessions, like maybe like a year from the initial assessment, you can actually compare those scores to see how they have improved in their level of function and on the continuum. So then you have your standard error, which again, you would find in your Appendix B of your user's manual. Again, and that's on page 89 if you forget. This is the score that just represents where one may be if you were to test how much error they may be if you were to test the student repeatedly. So it's also known as the standard error of measurement. And unofficially, not every therapist really documents this, but because it's more functional and necessary to look at the criterion and raw score just to track progress of your client. So what does the OT have to do in all of this? So occupational therapists use this assessment to provide the student with the best possible education and experience in the school system. And they do this by enhancing their academic and social components of school and obtain vital information regarding the student's limitations. So it's just another way of saying that occupational therapists will use this assessment just to see how well the student is participating and performing in the school system, whether that's socially or academically, and both, and to see what may be holding them back or impairing them from being successful. So the way us as therapists are going to administer this assessment, so there's 3 different ways. There's a coordinator method, which one person is responsible for getting all the information, whether that's they are identifying the appropriate people to complete certain sections. So you may not have the guidance counselor fill out the physical activity section because they may not be the one that's observing them complete physical activity. So that's where you may go to the physical education teacher and so on and so forth. Next, you have the collaborative effort method, which all school professionals or those who observe the student performing and participating will work together to complete this assessment during a meeting, and specifically maybe an IEP meeting. And then lastly, you have the single respondent method. So us as therapists may complete this entire assessment on our own just based off what we have seen of the student, or you may be giving it to a teacher who comes to you and says, this one student's really having trouble with their handwriting and I'm not sure what's going on. Then you would give this assessment to the teacher and have them just fill out the fine motor section. But then you may ask, well, this is the OT's role and these are all the different administration methods, but how do we do this via telehealth? So that's why I'm here, is we've learned about this assessment and we've learned how to administer it in person and all the different components of it. But via telehealth, it is difficult with copyright rules to and legislation to abide and complete it successfully over telehealth. So what I recommend, and there are going to be some hindrances that may prevent you from doing this in a standardized manner, but if there are ever ways that you aren't completing it and following the exact directions from the manual, you would have to document as completing this in an unstandardized fashion. So what I would have you do is complete this on a telehealth session, having the testing materials in front of you yourself, and you may have the caregiver or teacher, whoever is with the student at the time, go through with them one question at a time, depending on if you're doing all of the sections, just a couple, whatever needs to be assessed, asking them and reminding them of the rating scales and asking them to verbally give you a score out loud. And you can have them provide them with a piece of paper that you've electronically sent them that has the key for the rating scale so they don't forget, so they can have that on hand in front of them when they're answering your questions. So thank you guys for listening. If you don't mind, I have a QR code here that you can scan. You don't have to do it right now, but if you could, before you leave today at some point, scan this QR code and just fill out this survey, answering a few questions on this in-service training, and letting me know what you got out of this today. And I hope that this you learned a little more about the SFA and how to administer it, and specifically how to do it via telehealth. So if you guys have any questions, go ahead and you can ask me now. If not, that's all we have for today.
Thank you. It was very
Thank
informative.
you. Yeah,
Thank you.
very.
All
I
right.
learned quite a bit. Thank you.
Thank you guys. You guys have a great rest of your evening.
You too.
Hear me?
Hello?
Can you hear me?
Yes. Are you recording?
Yeah, but I can cut this part off. I don't really know how to stop it.